Here we go.
It is happening. It took us a little while, John. I'm really excited to see you. What is going on? John Gibbons. Woo!
Thank you for the invitation. Very appreciative.
Very, very excited to finally get the chance to spread the word of you, and not that the word isn't already spread, but at least help with that. And I have to say, I've been doing some research on you, and you are you have created the Body Master Method. So yeah, yes, it's a very, very nice shirt, by the way, very well fitted. And please tell us a little bit about what got you into teaching body work.
Well, I started when I was in the army, in reality, because I joined the army when I was 16. So I left school when I was 15, didn't really know what to do. So I joined as a mechanic, and then mechanic electrician. So I was fixing vehicles, and then that helped me basically many years later to understand the wiring system of the body in terms of the nervous system. So that was like a bit of a bonus. So if a wire is cut, it's obviously an open circuit, and you have short circuits. And obviously the battery is not working, and then you have to try to find out where that missing sort of wire is. And obviously the nervous system sort of follows, well, it's not the same pathway, but it helped me with my patients. So then I became a physical trainer in the army. So then I'm now branching into the physical side, and I did that for a while because I did 12 years in the military. And then whilst I was in the military, because everything is related, anything is related, say, to physical. So I could do like sports therapy and sports massage. So I sort of started whilst in, because the army basically paid for me to do lots of things. I even did my exercise to music, step aerobics. I became a mountain leader, cave instructor, skier, and it just went on because it's I was just everywhere. Germany, Cyprus, just teaching all this stuff everywhere. And then I decided to leave the army. At the time, it was for a lady who we were going to go and live in Dubai, and I was going to be like a trainer. But it didn't quite work out like that, as life's challenges give you. And then when I started teaching for a college, when I left, and I was teaching sports. In fact, I was teaching public services like map reading, exercise therapy, if you like, for students who wanted to join the police or the military in the UK. And then I did sports massage. So I was teaching that for Reading College. And then I was teaching for a company called Premier, who I trained with the army. It's mainly ex-military who would teach for them. And ex-military would attend these courses. So that was quite nice because I was still still military-fied, even though I'm now teaching the therapy side. Then I trained as an osteopath because I'm now based at Oxford University. So I run a clinic there. And then I spent 5 years to be an osteopath. So I finished that in 2003. So I was a physical trainer, sports therapist, osteopath. And now I'm involved in lecturing. So I'm now teaching the fifth-year medical students. And I'm also teaching the MSc in sports medicine. So there was doctors, physios, athletic trainers from the US. So that was quite good because then I started to look after the boat race team. So the Oxford University boat race. So I did that for 10 years. So I would be with all the Olympians, because loads of them were Olympians, the Canadians. And in fact, my first year was 2006 boat race. And we had Barney Williams, who was a Canadian Olympian. We had Jake Betzels, who was Canadian. We had Dr. Schroeder, who was an American. He was like 6'9". I think he's a doctor. So he was quite cool. Yeah. So I call him Doctor. But I'm probably 5'8", and he's 6'9", so pretty tall. So that's where I sort of started from. And obviously during my time, I was treating probably 20 patients a day at Oxford University. So I'd be looking after the students and the staff of Oxford and anybody else that wanted to come and see me. So it was mainly like osteopathy and body work, maybe not so much on the simple massage techniques. It was more almost like implementing an osteopathic technique with maybe a manipulative technique and then maybe using some other stuff, like the Graston tools. I'm not trained in Graston, but in UK, we have similar sort of concepts, the instrument assisted soft tissue mobilizer. but it's all stemmed from the Graston sort of tool, I think, as far as I'm aware. And then I was teaching my own courses. So I started implementing, I think I did because many students wanted to learn about the pelvis. So I think I started with muscle energy techniques, which is an osteopathic technique from Fred Mitchell in like in the 40s, 50s, I think 48 doing those, which is similar to like a PNF technique, which has come from the physiotherapy profession from a similar sort of decade. I think it was around the 60s. So then I started teaching like a 4-day, no, it wasn't, it was a 5-day pelvis course, because all these sports therapists or athletic trainers wanted to understand about the pelvis. So then they didn't want to spend, say, $80,000 on to becoming an osteopath, but they wanted to look after patients who had SI pain, back pain, hip pain. So then I devised this course, and then it seemed to be really popular. And then from there, the pelvis course evolved and evolved. So it went 5 days to 4 to 3, then it's 4, then 3 minutes. And now I've written a book on it. So my books are, one sec, I'll just get my book. So my book is there. You probably can't, it's upset, yeah. So I did this one. I'm not sure when that was, 2016 maybe. So it's pretty full on. So it's 200, quite a few pages, 270 pages just on one area of the body. So I've used quite a lot of referencing from Vleeman and Dan Lee, who I call the God and Goddess. Some stuff with Myers, Schamberger, Wolf Schamberger, who has his own malalignment book. So I tried to adapt a lot of stuff from that. And that's worked quite well. And then from there, I then thought, well, maybe I'll start implementing other courses. So then I started teaching like a shoulder course, and then subsequently I've written a book on the shoulder, which is quite nice, because when the students attend my shoulder course or my pelvis course, they will get this as the course notes. Nice. So when it's on, which they like, rather than me giving like a booklet, which I hated doing. So if you do my knee course, I would give you like a pamphlet. It's maybe 20 pages. And it almost irritates me a little bit, because I'm writing a book on the knee, but it won't be done until, I don't know, 2024, because I've got to do a hip book first. But I'm doing a spinal book at the moment. But I've also got to do a second edition, MET, which is my first book. So I've done 7 books now. So thank you. So if you basically do 7 courses with me, you will get a book that I've written. And my most recent one, sorry, I should have done this prepared.
That's okay.
Over there. I don't know. Where's it gone? Yeah. Sorry.
That's okay.
It's my nerve book, but
we'll post everything. I'll post your website and how to find everything. One of the things too that I found with your courses is they're very meticulous and very thoughtful and very well spelled out. So it's almost like I can see that happening, where you get a book when you go to one of your classes, because you really, I think one of the things that caught me at my ear first was how I think some of the great body workers like yourself, they're always paying attention and comparing and finding like cool things that they can relate the body to, and cool things that they have in their experiences to keep building upon and getting deeper and deeper and deeper into being able to teach and express what their findings are. Yeah. So I thought it was real cool. They're the first time I ever heard like the working with the electrical wires, but it makes such sense, and through the military and doing all these cool things. Yeah. So I just want to say thank you for all that. What a journey.
Yeah, that's okay. That's very kind. Yeah, no, it is. So, you know, and I do have, I think my last count was 404 videos on YouTube. So yeah, and they were hitting about 4 million views a month, which is quite a lot. I think I'm down to about 1 million or so now, but YouTube, it just goes like this.
Yeah, it does.
It goes up and down, up and down. I get about 20 questions per day about stuff. You know, awesome. My knee hurts, my shoulder hurts, and I try to be pretty active. I try to answer those questions as best as I can. But it's interesting, because obviously they'll say, "Oh, John, what exercises can I do? You know, what do you recommend I do for my pelvis or my shoulder pain? I've got impingement of my hips." And I'm like, well, it's hard for me to recommend an exercise whilst I'm typing.
Yes.
Yeah.
That's one of the things I've read about that you say, and I read in when I was researching you, was, you talk about the symptom. It's not always, you can't treat necessarily the symptom. What's the cause? It's really hard to see the cause when you're typing away online.
Yeah, well, exactly. But because I've probably seen, I tell my students this quite often because I'm a pretty active teacher, and I've probably been teaching for, I don't know, 20 years maybe. It must be 20 years. It must be. So I've taught thousands and thousands of therapists. I've even had like someone from Australia who's come to Oxford University to do a one-day course with me. I've had people from Korea to do 2 days, Iran, Thailand. So that's quite nice. So they literally travel, like a 20-hour plane flight to do like a course. And I think I've probably seen about 100,000 patients, give or take. But like even like my 20 students on a course, they'll normally say to me, John, have you seen this? And it might show me something with their knee, or show me something with their ankle, or show me something with their shoulder. And I said, in reality, I probably have seen every single musculoskeletal injury there is to see, but not just like once or twice, probably 50 times or 100 times. They're almost like, but to that person who's maybe newly qualified as a therapist, they might not have seen a grade 3 tear of the pectoralis muscle tendon here, whereas I've probably seen 10 or 20. Like ankle inversion sprains, I've probably seen 300, 500,000. So I've probably seen most things. So when all these students say to me, have you seen this? I go, well, hopefully. And I don't know. So I normally, when I teach my kinesiotaping course, even though it's probably one of the simplest courses I teach because it's basically about tape. But when I apply the tape, I will normally say that what we are applying the tape to is 99 times out of 100 will only be the symptom. And you almost have to say where the cause would be. Like someone might say to me, oh, John, can you apply tape if someone's got a piriformis syndrome? I said, if you believe there is such a thing as a piriformis syndrome, and then obviously you can apply the tape over the central buttock area, and then it might alleviate some of the symptoms. But what you have to try to remember is, if the symptoms is in that central buttock, it might not be coming from the piriformis as such. It might well be coming from a pathology directly within the hip joint, or it might be referring from the SI joint, or it might be referring from the lumbar spine. So the chances of having central buttock pain that's localized to that piriformis muscle is probably close to 0, if I'm honest. Thank you. And many people have come to me. They've even had steroid injections directly into the painful site in the bum. And I'm saying, it ain't going to work. It's not going to work. I said, it's just going to, it's just going to go on and on and on, and everybody's going to treat. In fact, I had a patient last week, and no offense to the therapists you've seen, because we've all got skill levels, whether we're a chiropractor, a physiotherapist, an athletic trainer, it doesn't really matter. So he saw me, and he's had back pain and knee pain. He's had 3 MRIs for his back. He's only a young man, 35, and he's had knee pain. And I'm saying to him, so he's having 2 chiropractic sessions a week, and he's having 2 acupuncture sessions a week. And the acupuncturist says your glute medius is very tight, so he puts an acupuncture needle in to try to release the muscle. And I'm saying, but you've been doing this twice a week for 6 months, 8 months, 12 months, and you see the chiropractor who only manipulate, this one particular chiropractor, they're not, obviously there is a variation of, is only manipulating his lumbar spine. I'm not really looking at anything else. And I said, have they looked at your hips? And he said, well, no. I said, as he sat there, I said, can you cross your leg over? As he put one leg, like a tailor's position, where you lift the leg over, the exercise I mean? Medically, it's like the Faber test. So it's like the flexion abduction with the external rotation. And if you've got any pathology within the hip joint, it would normally show itself on that one simple test. So when he said, I'm struggling to cross my leg over, and I said, well, we need to look at the hip joint. So when I looked at his hip, if you think about anatomically, we'll need about 35 degrees of internal rotation of the hip and about 45 degrees of external rotation of the hip. But when I test him, he had probably 0 to 5 degrees going in and about 20 going out. And I'm saying, your hips are so stiff. And I'm saying the problem is It might not be an impingement within the hip because it's bilateral and typically is more one side than the other side, or if you've got an impingement. But I'm saying if you're a man who is 65, I would say you've probably got arthritic hips. But because you've mentioned when you were 10, 15 years old, 10 to 15, that you play football and you'd have hip pain, I'm saying more than likely, structurally, you might find that there's pathological changes within the hip, not degenerative changes, just structural abnormality, where you might have like a dysplasia. There is a condition, normally affects boys between 5 and 10, 11, is called Perf's disease or leg caldate Perf's. I'm not saying he had that. I said, just have a routine x-ray of your hip joints rather than an MR scan, just to rule out, look at the socket and how deep it is, etc., etc. And then we'll just take it from there. But I said, just work on mobilization on the hip joints, and you might find the back pain. It works as a triangle. So the lumbar, the pelvis, and the hip is like a triangle. Problem with your hip joint, you will have a problem with your back. A problem with your hip, you will have a problem with your knee. Okay? So when your knee has symptoms and your back has symptoms, and if you treat the knee, you'll never get rid of it. And if you treat the back, you'll always have back pain. It'll always go on. It's like Dr. Ida Rolf, a famous Rolfer, who taught Tom Myers, etc. I think she says where the pain is, the problem is not. So I normally utilize. It's probably not exact that phrase, but it's very similar, and I quite like that. So I use that. So where the pain is, the problem is not. And even my friend James Earls, we try to utilize those sayings and stuff. So so I like that. So if you only focus on where the pain is, I say to my patients and my students, I said, the only person interested in the pain is the patient. And I'm saying you as the therapist should be like a detective, and you should be trying to, rather than chase the pain, or John, my back hurts, why are you looking at my hip? Or my knee hurts, why are you looking at my hip? And I'm saying more likely the causative factor is above and below the joint. So if you've got knee pain, it's normally a symptom, and it's the weak link in the chain. So there's hundreds of causes of knee pain. And we obviously have to look at the foot biomechanics, and even like the great toe, the hallux, you need at least 45 degrees of extension to walk and run normally. And then you want to be looking in the hip, and if you've got a hip problem, you'll have knee pain. If you've got a foot problem, you'll have knee pain. So if you just treat them.
I love listening to you, and it's true, because I mean, even yesterday I had people to my house, and the woman was like, "Oh, my knee, I got a shot in it." I'm like, "Why would you get you don't want to get into it too much when you're having, playtime at your house or whatever." But I can't believe how far body work is coming, and seeing some of these things that doctors are just now, focused on the symptoms. So it's really nice to hear you, and you just explained it so beautifully that oftentimes it's not at all where the pain is, it's around it. And I'm excited to check out some more of your classes. You do live classes too. You're located in
Swindon.
England, so Swindon. And
I was in Oxford University for my clinic was based there, but it's literally my contract ends next month. So it's been closed since March of the COVID. So sadly, I thought, well, and my online courses, because my teaching was, I almost said to myself, I'm not going to be doing online courses ever.
Everyone did.
Ever, because I prefer teaching not one-to-one, but I prefer teaching in that environment. I show you where to put your hands, especially like spinal manipulation, using a towel, using the shape of your hand to try to manipulate and all that stuff. So I physically would need to be there to show you. But then because my course is, because I've written these books and then I've done all of the content, a friend of mine, Sarah Jane Wall, said, you should try to utilize what you've got into content. And then when I look back now, I think, for God's sake, John, why didn't you do it a few years ago? Because it's remarkable how it works. And I think the students really like it, because if you come to me in a shoulder course, I would teach you, say, 6 hours. But like you're saying, it's hard to take in constant, because I talk and talk and talk, and I'm giving information all the time. A lot of my therapists will use a dictaphone and record it, so they'll watch it. And I think, well, it's almost like an online course there, because the online, they have 100 lessons, which would take you, say, 3 to 4 weeks if you do 2 to 3 hours a day, because there's 18 assessments. Whereas the face-to-face course is only, say, 6 to 7 hours. Whereas there's no exam, you get a piece of paper at the end of it. But when I say test you in a week's time, you're like, oh my God, I remember, you know, the supraspinatus, you know, the nerve innervation, and where does it go to, and what does it do, and how does the scapulohumeral rhythm work together? You're like, oh my God, I can't do it. But in your own, watching the screen with the book on the shoulder, you can go through it slow time. Like the nerve is an interesting one. My nerve course, I tell my students that the nerve course will be the most valuable course you will ever do, I believe, in your life. But it's never busy. So my shoulder course is always full. I'll get, say, 18 students on a course. But my nerve course, I'll roughly get 6, 7, 8. And I think it's almost like nerves. Oh God. Oh, I'll leave that for another day. And and then another day comes and I'll go, oh, maybe I'll do it another time. And because I have a diploma that's 10 courses, they have to do it. But they almost don't want to do it because it's a fascinating subject, but it's so complex. It's like when you watch one of my videos of me, I'm talking about the brachial plexus. So I'm talking on a whiteboard and I'm literally drawing all the nerves just by my memory. So I'm drawing almost like a London Underground. Yeah, and I'm saying the median nerve will come from C5, 6, 7, 8, T1, and it becomes this, and it goes, and it's applied. And another video then explains all the muscles that it goes to. But my online nerve course is my most popular. So because I think people say, I can do it online, slow time, and I can just watch, and if I don't understand, stop, have a cup of tea, and watch it again, pause it.
Rewind it, yup.
Yeah, and then I might do my assessment, because you need 100% pass to get through it, but you can check your results where you went wrong and retest. So, and I think it just seems to be working really well. So I'm quite pleased with that.
I'm quite pleased that you're going to have a few of your classes on the Massage Mentor Institute, and we're going to probably get those up in a few weeks. And
Yeah.
I'm very excited about that. And I think that you're not alone with that. Online class, I used to get so pissed. I'm like, you got to be kidding me. Online massage class. But then the more that they're on, you know, one, you get the best seat.
Yes.
2, you can rewind, like you said, you can take your time, and the more intense stuff, you know, you don't have to, like, you're not sped through it. You can kind of do your own pace. So they're really great points. And and
you get a certified, certificate at the end as well. But they are, you know, don't get me wrong here, they are pretty full on. So it's if you're going to start with one, maybe like the MET or the glutes one or the K-tip, because it'll get you into the process. Like my soft tissue course, it's 120 lessons, and it's 22 assessments as part of it. So it's, you know, it's pretty good. But it's like people say to me, it just never seemed to end. It's just like another lesson, another post is unlocked, and another one, and it's just ongoing. But you know, and I think, well, that's good value because there's not drastic money for the courses. You normally get like a discount code, and once you've done one course, you get a discount code for the next one, and it seems to work well.
I've been hearing great things from a lot of times. My staff members will be like, "You have fans at Freedom Massage." They're like, John Gibbons. So they're probably sitting at home like, oh my God, he's on. So you're doing a great job, and I'm honored to get a chance to talk with you. Hopefully we'll get you back again, and we're going to get you involved in some more stuff. And thank you for your years of hard work and your persistence and your meticulous work and videos and everything that you're doing. Is there anything that you want to leave us with? We're going to put up your website and how to contact you and what people can check out. But is there anything you want to leave us with?
No, I'm okay, I think. So you can access the online stuff quite easily. My YouTube video, maybe just search me John Gibbons. I did a talk actually with Bob and Brad.
Yeah.
You know.
Yeah. Sure, I do.
That was great.
Yeah.
Yeah. So well, it was actually Bob on his own rather than Bob and Brad. So that was quite nice to talk to him, because they are pretty popular. I think they're like 3 million subscribers.
Yes.
So they sent me literally today. They sent me like a Bob and Brad, like a little mini massage gun.
Oh, cool.
Yeah.
Nice.
So that was quite nice. So I like them. I like the trademark on and the painting. So it was quite cool. So I will use that. So
Nice.
yeah, if you have any questions, you can just contact me on email. And so I normally will answer questions quite quickly. So people normally say to me, "Oh my God, I can't believe that you respond like within." I try to answer within one day, if I can, rather than leaving it for. I'm after off to Scotland on Friday in my motorhome.
Oh,
So
nice.
we're gonna go to the Isle of Mull and the Isle of Skye.
Oh, wow.
Yeah.
Very cool.
So, yeah, and I'll put a motorbike on the back of my van. So so we'll have a week. Yeah, I've got a few motorbikes. So it's yeah.
Very
Yeah.
nice. Thank you, John, so much for your time. Hang tight. Everyone, John Gibbons. We'll put all his information up so you can check him out. Thank you for your time, John.
Thank you. Thank you. It's been great.